Today, in this lecture, we are going to talk about concepts related to autoregulation of GFR in renal blood flow. Now, as we previously discussed, that autoregulation of the GFR in renal blood flow simply means that with changes in the arterial blood pressure, the values of GFR, the glomerular filtration rate, and renal blood flow are kept nearly normal. They are kept nearly normal even with changes in the arterial pressure, and that is the autoregulation of GFR and renal blood flow. Today we will talk about the importance of autoregulation of GFR and renal blood flow. We will discuss why is it important to maintain a nearly normal level of the glomerular filtration rate and renal blood flow despite of changes in the arterial pressure levels. So we will briefly talk about the functions of the kidney, the nephron, and the filtration process, and then quickly come back to the importance of autoregulation. As we have discussed multiple times that the kidney is made of thousands of nephrons. These are the nephrons which we have discussed in detail so many times, and the function of the nephrons is that they filter the fluid, and the filtrate then moves through these tubules, and these tubules basically help in the process of urine formation. Now, blood basically enters the nephron at the glomerulus, where in the glomerular capillaries filtration process occur, and that filtration process helps in the formation of filtrates, which then moves down in these tubules. Now, if we enlarge this area, we will see that this area look like this. This is the Bowman's capsule. This is the glomerular capillaries. Blood is entering to the afferent arteriole, then the efferent arteriole, and the filtrate moves through the Bowman's capsule in the tubule. Now, the speed, the value, the rate with which the filtration process is occurring in this Bowman's capsule, blood is being filtered and the filtrate is moving down into the Bowman's capsule. The rate, the speed, the amount with which filtration occurs is the GFR, the glomerular filtration rate, and the blood flow that is coming into the glomerular capillaries through the afferent and efferent arteriole, that blood flow is subject to variation. The purpose of this lecture is to discuss that why is it important to maintain a steady rate, nearly constant or nearly normal rate of the GFR, the filtration rate, and the blood flow, and that is the autoregulation, the importance of autoregulation. So, we previously discussed that these two values are kept nearly normal despite of changes in the arterial pressure. We discussed that the normal arterial pressure is 100 mm of mercury, the normal GFR is around 120 ml per minute, and the normal blood flow is around 1100 ml per minute. If changes starts to occur in the arterial pressure, if the arterial pressure starts increasing or decreasing with a big change, even if the arterial pressure drops to 75 or it increases to 160 mm of mercury, still the value of the GFR between these two values, between these two changes, and the value of blood flow, the blood flow and the filtration rate, they are kept nearly normal with minimal changes. Now, they are not kept 100% normal, but they are kept nearly normal with minimal changes. And we also discussed that with the increasing and decreasing arterial pressure, the urine output increases and decreases. This is the urine output. It increases and decreases with the increasing and decreasing arterial pressure. But the GFR and blood flow are not increasing. Now, the normal GFR, the normal glomerular filtration rate, here the amount of fluid that is filtered normally here is around 180 liters per day. It is around 180 liters per day. So here the fluid is filtered. Around 180 liters of fluid is filtered in the nephrons in a single day. Out of that 180 liters, around 178.5 liters are absorbed back into the peritubular capillaries. So we discussed in this nephron that filtration occurs here, and when the filtrate starts moving in the tubule, some of the filtrate is reabsorbed, and the reabsorption occurs like this. This is the tubule, the reabsorption occurs into the peritubular capillaries. That reabsorption is around 178.5, and the remaining 1.5 liter per day is the amount of urine. Now what will happen? This is basically, this 180 liters of filtration, 178.5 liters of reabsorption into the peritubular capillaries is at the arterial pressure of 100 mm of mercury. When the arterial pressure is 100 mm of mercury, normally these are the values. But what will happen if the arterial pressure increases? If the arterial pressure increases by 25% and it becomes 125 mm of mercury, somewhere here. Now, if there is no autoregulation, and the GFR, the filtration rate, and the blood flow rate is not kept in nearly normal range, and there is no autoregulation, then what will happen that with a 25% increase in the arterial pressure, the GFR should also increase 25%, and the GFR should become 225 liters per day. 225 liters per day. If only if there is no autoregulation. But normally it will not happen. And if the filtration per day becomes 225 liter per day, and the amount of fluid that is absorbed, the amount of fluid that is reabsorbed into these peritubular capillaries, if it remains the same, if it remains 178.5, then the urine formation per day will be 46.5 liters per day. Now this is a very big amount, very large amount of urine, which you cannot even imagine someone passing 46 liters of urine per day. But the nature has given some has put this autoregulation in the kidneys. Now this autoregulation will never allow this much amount of urination to occur per day. And you see, when the arterial pressure increases, if the arterial pressure increases, not only 125 mm of mercury, like not only 25%, even if the arterial pressure increases to 150 mm of mercury, still the GFR will not increase that much. The GFR will not increase. So the GFR here is 120. At this 100 mm of mercury, it is around 120. And even at 150, the GFR is still around 120. So by no means will the GFR automatically increase with the automatic increase in the arterial pressure. And that is the purpose of autoregulation. Now, if the GFR somehow increases, then the reabsorption of the fluid from the nephron into the peritubular capillaries also increases from 178.5. The reabsorption also increases. So these two things will not allow the tremendous amount of increase in the urine formation per day. Now, despite of these changes, some increase in the urine formation do occur, and that is the pressure diuresis or the pressure natriuresis. But most of the time, nature has protected the human body from these changes with the help of autoregulation of the GFR and the autoregulation of the renal blood flow. The systemic arterial pressure may increase or decrease, but the GFR, the glomerular filtration rate, and the renal blood flow, the amount of blood that is flowing here into the nephron, it remains nearly normal. It remains nearly normal in this range. In this range, it remains nearly normal. Now, if the arterial pressure starts falling below this level, there is a decrease in the GFR, and there is a decrease in the blood flow, and above this level, there may be slight increase in the renal blood flow and the GFR, but in a very big range, which do occur normally in the human body, these values are kept nearly normal. And the importance is something which we discussed now, that the importance is to maintain a nearly normal conditions of the human body, to maintain near normal fluid volume in the human body, to maintain near normal urine output, and to allow and they do not allow any tremendous or abrupt changes in the electrolytes, because when filtration process increases, the electrolytes that are moving out of the human body also increases. So these things will protect the human body, and that is the importance of autoregulation of the GFR and renal blood flow. How the autoregulation occurs is something which we are going to discuss in our next lecture. Thanks a lot for watching the video.